This is Project Implementation Phase 3, Step 6, Continuous Feedback on EHR Use, and Step 7, Depute a Change Management Specialist for HIMS 670, Health Informatics Administration Capstone. The agenda is going to be the background, the purpose. We want to discuss continuous feedback on EHR use. Then we want to talk about deputing a change management specialist for the responsibilities for planning, implementing, and evaluating change, and then a conclusion. There were 3 phases to this implementation. Phase 1 was initiation and planning, Phase 2 the execution and closing, and Phase 3 is the change management. In HIMS 650, we completed Phase 1 initiated and planning. We delivered the description of an existing paper-based medical record system. We identified the stakeholders, project team, and project manager. We developed a EHR implementation plan. We planned for the resource requirements, human resources, finance, and project management software. Then we looked at change management plan. In HIMS 661, we completed Phase 2 the execution and closing of the project, and delivered the work breakdown structures, the system acquisition, including RFIs and RFPs, provided the EHR implementation schedule using a Gantt, outlined a communication plan with the stakeholders and team members, laid out the monitor and controlling with scope, tree, time, task, budget, and quality, outlined and executed the testing, the unit and integrated performance system testing, and then the closing and signing off of the project completion. And we're here at HIMS 670, and we're developing Phase 3, the change management plan. It's a 6-step process, and we're to consult with relevant resources for each step and guidance. The purpose is to discuss the 6th and 7th of 7 post-EHR implementation steps for change management, and then how to help staff transition it. We want to include the continuous feedback for EHR use, and want to talk about deputing a person responsible to lead the change management. There are a number of methods where EHR can receive meaningful feedback from patients. There's patient portals, automated patient satisfaction surveys, and then outcome tracking. Patient portals is where the patients manage their own healthcare, and it's an optimal place to collect patient feedback. Automated patient satisfaction surveys are done with EHR based on some type of activity. It's automatically sent out either in survey form or in question form, and it could come out in various methods such as text messages, phone calls, or emails. The last one is outcome tracking. EHR systems have a great ability to collect all the information, which you can condense, sort, and analyze. You can look at the changes in the treatments over time and can deduce different types of results based on that information. According to Vance, patient feedback is an excellent tool for continuous improvement in order to track and improve the performance outcome and the interaction of the patients. EHR improvements can also come from internal users through periodic feedback. According to Heath, the importance of doing this usability testing during the initial design is really critical for making technology more seamless with clinical workflows. These improvements in the clinical area include the providers preferring the EHR as a screening tool, and also the ability for the providers to access all clinical information of each patient during each visit. Feedback helped in the administrative area by improved usability between the medical office assistants and the patients that resulted in more intuitive workflow and navigation, and also automatic alerts between the medical office assistants and the health coaches. As far as the infrastructure is concerned, the periodic feedback really helped the architects and the IT really understand that clinical practice is dynamic and that it's important that EHR usability testing and clinical workflow is adopted in that manner. It's important to have post-evaluation surveys to improve usability and workflows. According to Health IT, during the post-implementation evaluations, identifying unresolved vendor issues, interface issues, and staffing needs are critical to making it successful. There's a number of categories of questions that you want to ask to ensure that the EHR is being effective. We want to look at culture and adoption, network infrastructures, and then the EHR vendor. Some of the questions we want to formulate revolve around what do we learn about ourselves that we didn't know? Do we have everybody using the system as they migrated into it, or are there some providers still waiting? Is the workflow processes being reviewed, and are providers actually reviewing the workflows, or are we actually using the old workflows? Is there any additional training that's required? Are we capturing all the data information for internal prioritization? Are there any unplanned consequences as a result of the implementation? So we'll fashion these in some very simple survey questions to be asked for culture and adoption. Some of the questions we want to ask with respect to network and infrastructure are, is there any bottlenecks or downtimes? Have we tracked or are we logging them? Is all the technology in the right places for everybody to do their job? How reliable is all this technology between the software and hardware? And the last one, and the kind of an important one, is, are we ensuring that all the PII is being protected? The last category of questions we want to ask revolve around the EHR vendor. What we want to do is we want to know, is the EHR vendor performing everything? And have we learned anything that we need to add into the requirements that they need to provide? Also, are there any issues? Do we need to kind of work through the vendor technical support, or is there anything that we need to escalate that is causing the organization for not able to fully implement and adopt the EHR? Once you've compiled the number of questions and the types of categories to be surveyed, the next step is to look at the types of patient survey software available. There are a number of products out there, and the areas that you need to look at are the deployment, email marketing, the ability to survey, branch logic for questions, have a question library, maybe skip logic, and then customization of the URLs. So what you have here on this list are the top 5 from Capterra, and that will be that will help you in assessing the best way to disseminate these surveys. According to the National Learning Consortium, there are some critical factors required and management interventions required for managing the change for EHR implementations. Some of the responsibilities include having a clear vision of the future state, being able to create and manage a plan of action, having a real good knowledge, being able to put together a leadership team, being able to identify and lay out a communication strategy and also a communication plan, and then being prepared to train and retrain staff as well as providing technical support. So the Managing Change position advertisement includes all these items that were just discussed, as well as basic HIM responsibilities. So what we want to do is we want to cover the primary responsibilities that include that include all the requirements from the National Learning Consortium. Then if you go down, additionally, there needs to be a knowledge of clinical documentation, as well as any state, federal, or accreditation requirements, understandings of the medical record system, being able to understand the regulatory activities for state, federal, and organizational accreditations. Also be responsible to understand the revenue cycles and be able to manage the workflows and identify workflow discrepancies. So the qualifications are going to include a master's degree in HIM with the corresponding certifications of RHIT or RHIA at a minimum 5 years of experience inside a hospital with leadership roles as well. Having a complete understanding of HIPAA and its compliance, being able to work as a lead and work independently. Keys here also are being able to communicate well and be able to identify things that need to be addressed and address them. And lastly, understanding the ICD-10 codes. So in conclusion, continuous feedback is important for both patients and the EHR providers administration. Patient feedback is real critical in improving the quality of care and understanding. Patient portal is the best avenue for that. Also, EHR providers and admin staff, getting their feedback is important earlier on in the process so you can make the course adjustments and workflow adjustments. And then the last thing we covered is managing the EHR implementation change management. It requires a lot of experience and a lot of exposure to not only project management skills, but have specific healthcare knowledge.
Thank you for watching this video. The next 10 seconds will be the references. Thank you.